And we are going to talk about a topic which I'm sure all of us are going to relate in the most natural way. And exactly, we're going to talk about and tackle mental health. So welcome on stage, Joan Low, CEO and founder of Thoughtfull, written with double L, and Antoinette, CEO and founder of Safe Space. Both the ladies are based in Singapore. Hello.
Hi, everyone. Thank you so much, Anna, for the wonderful intro.
Great. So as I said, we are going to talk about a topic which we've been hearing a lot in the past year for obvious reasons and for strong reasons. I would like to remove a bit, the noise and the buzz that has been created around it, but make it as human as possible. So to set the scene also, I would like to ask you to define a bit mental health from your digital health venture perspective.
Sure.
Who wants to start first?
I'm happy to start first. So hi everyone, I'm Antoinette from Safe Space. Very nice to meet you today. When it came to talking about mental health, being in Asia, there is still a stigma when it comes to using the term mental health, because mental health is also correlated with mental illness, and anything to do with illness implies that you are ill. So at Safe Space, we try not to use the term mental health or mental illness at all. Instead, we focus more on mental wellness and mental resilience, because that also implies that you are strong and capable enough to overcome any situation that you are facing. So for us, the real focus is really on using the term mental wellness or mental resilience.
Great. Thank you. I personally relate with the resilience side of it. I think we all need a bit of training to that. Joan?
Hi everyone, my name is Joan Low and I'm the founder and CEO of Thoughtfull. Very nice to meet everyone and thank you for making time to be with us today. I think echoing Ento, to be very honest, a lot of times what we do have when it comes to the term mental health, the first thing we think about is, stress or anxiety or depression. And that the first word that you associate with the term mental health is usually what falls into the spectrum of illness. But I think when you think about physical health, for example, if someone say, how's your leg doing? No one's going to think straight away like, I need to amputate. I need to, I have infections. That's not the first thing that people think about when you think about your physical body and your physical self. Unfortunately, when it comes to mental health, the association is there, and therein lies the stigma, as Anto mentioned. And so I think when it comes to things like this, how we do look at it here at Thoughtfull is looking at it holistically. Of course, I think we do not want to downplay people who are actually going through illnesses, who are really going through, their own pathway and their journey in mental health, because we have to acknowledge and accept. But we want to also remind people that is not the only spectrum when we talk about mental health in the space. There is also the side of health and wellness and well-being when we talk about mental health. And so we take a very holistic approach and look at it from that angle. So, regardless of whether you are closer to, one end on the spectrum or the other end, that is completely fine. Everyone's going through a journey and it's dynamic, and we are inclusive for everyone, really. And I think everyone will be on a journey together. So, yeah.
Fascinating. I'm now very curious to learn more about what each of you guys are doing in this space. So before jumping to that, you mentioned the word journey and path. You both have different backgrounds, right? And both landed as health tech entrepreneurs in mental health. Would you please tell us more on what brought you here?
Sure. Sorry, you want to go first, Ento?
Okay, you can go first.
I can tell you a story, then you tell my story.
Oh, nice. Yeah, we can do a cross interview.
I think I think one of the things that maybe, just to share, and the reason why Thoughtfull does emphasize on inclusivity, regardless of where you are in terms of in terms of your journey, is really driven by the why of why Thoughtfull came to being in the first place. So maybe a little quick background of myself first. I'm now in digital healthcare, but before this, I was actually in finance. So I spent the last 15 years abroad, spending a lot of time in North America, living in Europe and China for a bit. And then most recently, I was actually in Hong Kong for 6 years, where I was working for an American bank called JP Morgan, managing a portfolio of about $1.3 billion. So one of the biggest motivating factors for this huge jump, so to speak, from finance to mental health care is not as random as it may seem, because it is truly something that is quite personally driven. My family and I, we've been mental health caregivers for the last 20 years, very much on the spectrum of illnesses, which is why, our emphasis on looking at things holistically. Because that journey is real. And I think one of the biggest things that we know for sure is the pain points in actually accessing seamless mental health care here in Asia. The fact is, I'm very blessed to have had the last 15 years abroad, really pulling all the best practices from different areas, and particularly as well, in North America, where they're at the forefront of any form of healthcare digital innovation. And I think what really frustrated me was that digital innovation gap between what was happening in North America versus where we are here today, and how much more that we can do. And so I think when it comes to really, fulfilling that gap, I think that was probably one of the biggest motivating factors of how the journey of Thoughtfull started more than 2 years plus ago, and led us to where we are today. So today, Thoughtfull's vision is very simple. We want to make access to mental health care more seamless and affordable here. So yeah, that's, I guess, the pathway and the journey, as you said.
That's great. No, fantastic. Thank you so much. Hold your thought, as we're gonna dig a bit deeper onto actually how you're tackling, the gaps of mental health in Southeast Asia. Over to you, Antoinette, and your journey.
Sure. So, hi everyone. My journey was, I never intended to create a mental health startup. Let's just start there. So my background is advertising. I've been in it for about 12 over years now, looking after Fortune 500 brands and honestly making them richer and richer. So for me personally, I went through burnout myself. So I was actually on the client end, where I was looking for therapy services for myself. And it was during a time in Asia where no one talks about mental health, not at home, not at the workplace. And I've tried, firsthand the US-based platforms that were out there, because I wanted to find something more accessible, something that I could use in the comfort of my own home, because I was embarrassed to talk to anyone about it. So fast forward to after I managed to see a therapist, I found a great one, in all honesty, and I was able to overcome my concern. But that actually highlighted that there was definitely a gap in treatment window here. If you are someone going through a mental health concern, you're really not in the best frame of mind to be making decisions, because you're in a panic state. So what I wanted to do after that whole experience was, what? I'm already in the advertising tech space, where we work with other developers to create products. Why can't I just create a product when it comes to mental health, so that if this ever happened to me again, or if it happened to my team that I managed, they could have something that they could use that's firstly relevant for this part of the world. There is a reduction in the barrier of entry, and we carefully curated therapists who are amazing, and they could just use it in the privacy of their own home, anywhere and anytime. So that's how the whole idea of Safe Space started. It grew during the COVID-19 pandemic to what it is now, and we are really, really excited to be working with multiple stakeholders, corporate clients, to really tackle this area of mental health for this part of the world.
Great. No, thank you for the explanation of that. And you both mentioned barriers and gaps. So let's stick to this region and try to talk a bit more on the gaps that exist in actually tackling, mental health also touching a bit more the public health system. And of course, how you are helping in filling that.
Sure. So maybe I can take that one. So, we actually just recently conducted a research piece when it came to looking at multiple markets and the landscape of trends when it comes to mental health. There is definitely multiple gaps in the public system that we have identified. So there is about 5 different gaps in the public system that we have seen. So firstly, there's a really long wait time in terms of getting access to your mental health care. On average, to see a psychiatrist here is about 27 days, psychologist about 28, and anything to do with community outreach is about 14 days. Second point would be there is a lack of a centralized system, actually, and those who are experiencing any kind of mental health condition were just overloaded with the amount of information that's available out there. The third point is youths. With the recent news happening in Singapore and Malaysia, youths are now a very vulnerable group. And there isn't really a program to properly cater to their needs and for them to feel supported. The fourth point is affordability. This has been the number one sticking point for people to get access to their mental health treatment and to continue on with their sessions. So how can we solve the affordability gap when it comes to this in the public system? And the last point that we've identified is really stigma and self-stigma, actually. So yes, there is a stigma around mental health, but going through it yourself, and especially when you're a working adult worrying about unemployment, it also really impacts you as an individual, and it impacts your position in society. So there's definitely 5 very key gaps in the public system that are still being worked on, and we're hoping to work with individuals to see how we can solve this together with them.
Thank you. What about you, Thoughtfull? What is Thoughtfull doing?
Sure. Thank you so much, Anto, for sharing that, because I cannot agree more in terms of the gaps that there are out there. And for everyone, really read the research that Safe Space did, because I think it was very good insights into what's happening in the landscape right now. I love the work they do. I think another...
allow me to interrupt you a second. Allow me to interrupt. Antoinette, can you share where this research is available?
Oh, we actually just recently conducted it. We have done it one for multiple markets, actually Singapore, Malaysia, Australia. I'm more than happy to share it. It's something that we're going to be publicly putting it on our platform.
Yeah,
cool. Thank you. Thank you. Sorry, Joan, go ahead.
No worries. I think it's very good to always, as it is, the mental health ecosystem is very small. And I think it's always good that, we definitely, help each other collaborate and move the entire needle forward on this. One of the things that I think when it comes to the treatment gaps, not to, repeat anything that Anto has mentioned, we take a bit more of that clinical approach, I think. So for example, a lot of the things that we do focuses on making things more seamless. And when we talk about that, we talk about it from the perspective of a biopsychosocial model. So one of the first things that we actually built, even in-house, was our clinical capabilities in the team. Because one of the biggest things that we did realize in terms of the treatment gaps is the fact that there is a huge divide between bio versus psychosocial. And I think in Asia, traditionally, mental health has always been treated heavily on the biochemistry part. So maybe for people who are not in the space already, I'll just do a quick one-liner. Biopsychosocial. So on the bio side, you're talking about biochemistry addressing, meaning to say that it could be the psychiatrist who has identified perhaps a chemical imbalance, and so they would then prescribe treatment plans to help you rebalance that, and that will help you manage your symptoms a bit better. So traditionally, that's always been something that was the main focus and the first kind of point of treatment when it comes to mental health care in Asia. The psychosocial part are 2 separate parts. So you want to talk about the psychotherapy, for example, the talk therapy perspective. So for example, in this area, I think while the medication can help you to understand or rather manage your symptoms better, sleep better, eat better, moods are better. But what it does not help you with is that it does not help you to understand how you got there in the first place. What were the habits that got you there? And the social support, which then perpetuates that cycle, has always been a very big missing piece as well. And so I think the biggest gap that we do see in the public health system is that the bio is there, albeit not enough, and then the psychosocial is completely fragmented. Which is why we've been building the largest mental health network in the region, so that we can actually bring all of that together and really, deliver on our promise, although it's a very big promise, but we're definitely hard at work on that to deliver on our vision to bring access seamlessly to people from a biopsychosocial perspective.
Very holistic, since you mentioned that word at your opening. Fascinating, and thank you for sharing. Since again we are talking about the gaps, let's move a bit into a more current topic, that is that of COVID-19, of course, a pandemic one, which has amplified and potentially caused also other concerns and stress and sadness and all the negative feelings that are connected to that onto people. So I would like to explore with you a bit, what are those trends that you have been entering in contact, or probably using also, the people you have been talking to, the potential, patients and clients of your ventures. What has the impact of COVID-19 been in terms of causing something new or amplifying existing trends?
Okay, I can tackle that one first. So for us, we've actually identified 3 negative points, but actually one positive that came out of COVID.
Oh, wow.
First, yeah, there is a positive, so I'll touch on that. So the first one is stress. There is definitely more stress in the workplace. From the research that we've done, there's about 42% of respondents that felt that their workload has increased substantially during the COVID-19 pandemic. There has been a reduction in headcount, and there is actually more blurred work and home barriers when it comes to workplace, and that's causing a lot of workplace stress. The second trend that we saw due to COVID was there's actually less socialization and worsening of health. So about 91% of respondents from AIA actually shared that there was a decline in mental health. And there were more fears when it comes to overcoming loss of job and overall job stability. And about 1 in 3 adults actually experience psychological distress. Now, the last point that is one of the most alarming statistic that we saw is there has been an increase in suicide and an increase in suicidal related behavior. So the increase is actually between 2019 and 2020. So in 2019, there was about 11 individuals per 100,000 in the population. In 2020, that has jumped to 12.65 individuals compared to a 100,000 population. Now, the part that is quite sad for us to see is that when it comes to boys, the age group has increased. So boys aged between 10 to 19 years old has risen when it comes to suicide or suicidal attempts. So we're trying to see, on a safe space side, how can we tackle this? So one of the things that we're working on very closely now is actually how can we support youth, youth in schools, and also working with parents, because they are also the support system that the youth have. So not only are we tackling it from a corporate perspective, but we are also trying to see what are the other vulnerable groups within Asia that we can support. And I mentioned there was a positive that came out from the COVID trend.
Exactly. I was about to ask you, where is the positivity in here?
There was actually an increase in the utilization of mental health services. So the barrier of entry has decreased. So there has actually been a report of increased introduction of teleconsultation. So whether it's telemedicine apps, platforms like Thoughtfull and Safe Space, the utilization has risen, and I'm sure Joan can attest to that. Some of the common issues that we are seeing come through our platform is really employment, and employment from a graduate's perspective, and also the fear of job loss and fear of even catching COVID. That has actually come through a lot. And there's overall an increase in anxiety for this. So that's one of the positives that we have seen. And we are really hoping to see, when it comes to this, how do we move forward, ensuring that there is always adequate support when it comes to working with the general public, but also from a corporate perspective.
Yeah, I totally agree. I think it comes also from, the increased awareness around the topic itself. So the more we talk about things and the more normalized they become in the end. So also people, feel less stressed in talking about things, I suppose. So thank you for that. Joan?
Yep. I think when it comes to mental health trends, there are things that have been amplified, and there are things that have fundamentally changed, I would say. So when it comes to things that have been amplified, I think it's really undeniable that mental health challenges have always been there, whether it's stigma, whether it's stress or anxiety, or even depression. All of these things have always been there. But I think, as Anto pointed out as well, it's really been amplified because of the pandemic. How I see things is both from a top-down perspective as well as a bottom-up perspective in terms of change. And I would say, by and large, in the mental health space, especially here in Asia, it's been mostly a positive change. Of course, we are going through a tougher time. It is, undeniable. But to be an entrepreneur in the long game, I think you always have to have a bit of positivity in there. So I like to see the silver lining. And when it comes to the changes that we've seen from the top down, I think one of the most significant changes is the fact that policy is changing. In terms of whether it's on the medical regulatory side or whether it is on the governmental side, or even the payers of healthcare insurers, as well as employers and organizations. So I think, for example, here in Singapore, very quickly they put together a tripartite kind of commission to talk about and see what actions can be taken for mental health. That's something that's obviously very unprecedented, and they did it very quickly. Yeah. I think the other aspect, as well as you see in the US, FDA approvals for telepsychiatry has been expedited. So, you're seeing a lot of positive changes that are coming out of this, worldwide challenge of the pandemic. The other thing as well, I think, and this is more of a bottom-up change that we see, is the fact that the consumption of digital. So I think in digital and technology has been embraced by different industries over the past, couple of decades. You see e-commerce, you see finance, you see fintech, and all of that, right? How we shop, how we look for the love of our lives. Everything has adopted digital. The last few bastions of digitization, I would say, lies in healthcare, as well as education, as well as food. Right, so not food delivery, but the production side of things. So these are kind of the last few bastions that are still very much in need of digitization. And if there is one thing that has really kind of moved the needle on this, is the fact that we had to be isolated. We couldn't see people, in a face-to-face manner, and we had to adopt digital. And so for me, I think
we all remember.
We all, actually, some of us, if you're not fully vaccinated, we still remember. We're still in there. So I think from both a top-down and a bottom-up perspective, we see a lot of change, and I think it's it's here to stay. Things have fundamentally changed for the better. Yeah.
That's definitely positive. I mean, it's a good thing that this wave of change is taking place. Staying a bit more on the workplace arena, talking a bit more about employers. So decreasing a bit the spectrum of mental health, and let's explore a bit more on and if, of course, employers are doing enough in the realm of mental health for their employees. And I mean, I would appreciate a lot if you could share like case studies or campaigns or projects being launched to tackle mental health in the workplace.
Sure. Joan, do you want to go first? I've been going first for the first two, but happy to continue.
It's okay. Go ahead if you want. Yeah. We take turns. Don't worry.
All right, cool. Okay, so let's look at it from holistically. It is across the board, nationwide. In all honesty, a lot more can still be done. If we look at it from a statistics level, Singapore has the highest stress numbers, actually. It's very sad. And actually 60% of employers themselves already feel very stressed out. When we look at it from an employee perspective, when we do our own internal research at Safe Space, we also do our employee pulse surveys. About half of the employees were uncomfortable discussing mental health in the workplace, but they are all looking for mental health services outside the workplace. So more can be done there. And even from a top-down approach, which is what Joan mentioned earlier, for employers to be more open and vulnerable about, accessing mental health care, that can be done. And if we look at it from a business owner perspective, other startup founders and other business owners, about half of them did not feel that they should bear the burden of employees' mental health. So when we do our corporate onboarding at Safe Space, we also address this, where the employer has actually provided a mental health service, but the employees feel that, hey, you should always pay for my therapy sessions because you're causing me the stress. Two have to work together, because as much as the employer is also giving you an employee assistance program, you are also fully responsible to look after your own health and well-being first. You are your top priority. So we try and also reframe the mindset, and we do a lot of education to improve, firstly, mental health literacy at Safe Space from a corporate level, from a consumer level, and also walking them through trust and transparency. If they want to use a platform like Safe Space or Thoughtfull, for example, how do they check on data protection? How can we easily access therapists, and how do they know a therapist is actually the most suited for them? So a lot of education takes place, but I would definitely say overall, from a workplace setting, more can be done, especially amongst the age group of 30 years old to 50 years old. They find it more difficult to. Yeah, and I think more can be done for employers to tackle this age group as well.
Are you a Safe Space working with employers?
We are.
I'm not asking for detail. Just is the service available? Just to promote a bit here.
Yes, we are currently working with corporates as of January 2021 this year. Yeah.
Fantastic. Thank you for that, Joan.
Sure. I think when it comes to the workplace, or rather mental health at the workplace, we have to take into account that here in Asia, we have a spectrum of companies that have done it before. Most of the MNCs, for example, they might have traditional forms of employee assistance programs in place already, that were kind of put in place by the headquarters, either in the US or UK, or somewhere else. So there are some companies with some experience in traditional AAPs, and it's a matter of them moving up the ladder and incorporating digital as well in a more proactive manner. But then you have the other spectrum of companies as well, where they have no clue where to start. This is the first time that they've ever even heard of the term mental health at the workplace, and so the kind of offering and the kind of programming will have to be slightly different depending on which part of the cycle a company is in when it comes to employee well-being. So here at Thoughtfull, we actually do work with the entire spectrum. We have people who actually already know exactly what they want, they just want it better. And then we have people who have zero clue, complete blank canvas, and it's up to us to kind of craft it and co-create it with them to see what works best for the companies. So I think for Thoughtfull, we do cater to the entire spectrum, and I think it's very important because we are at this turning point where we do see, like I mentioned earlier before, right, fundamental changes. So when we started this business, it was pre-pandemic. When I started the groundwork, it was late 2018, early 2019. No one was really talking about it as much as they are today. So one of the biggest changes that we have seen is the fact that employers are now more educated about it, but more importantly, they're also more ready to invest in it. And so I think one of the changes you'll see is that it's not so much about just awareness and education anymore, albeit that's of course always important, but it's also about taking action and what they can do about it in a proactive manner. And so for us, Thoughtfull actually focuses more on the preventive side. So apart from telecounseling, whether online or offline, actually our app, the main thing that we do is one-on-one bite-sized coaching with certified mental health professionals. So it's a little bit different. And when it comes to proactive engagement with mental health, we find that that's something that's very much needed in the workplace right now. So yeah, and to echo,
I second that.
to echo what Anto said, definitely much more needs to be done. I think, Anto, we have our work cut out for us. Like, we're barely sleeping now doing what we do. So yeah, we definitely have a lot.
Let me know. No, thank you for this feedback and intervention. Just to complete a bit, the puzzle of healthcare, we didn't talk about insurance companies, and of course they are a part, of this big picture. Are you working with this group of companies?
Perhaps this one I can jump in first. So I think Thoughtfull was actually in a very fortunate position in the sense that everything kind of happened quite quickly. But our first client that we went to market with was actually an insurer. And until today, is still a partner that we work with very closely. And so absolutely, we are working with the insurance side of things. I think there's a lot of work that needs to be done. Asia is one of those regions where mental health care is not part of the coverage yet. And one of the reasons for that is because, again, there is a lack of insights into what that pathway is for a client or for a patient. It's very different when you talk about different therapeutic areas where there's a lot of insights already for insurers to create the products and coverage. I think mental health care is something that's still quite nascent, and so that's something that we do work very closely with insurers to work on. Yeah.
Great. Yeah, I just wanted to understand a bit more, the message shared with insurance companies. So just to bring them on board, to increase a bit,
insurers, you play a very big, you play a very big role.
Okay, cool, clear.
So let's do more.
What about you, Antoinette?
Yeah, sure. So I'm having the same conversations with Joan, I guess, in terms of this space. So, like rightly so, insurance is not doing as much as we would like them to, because I think there's only really 4 big players that actually have a mental health policy in place. So those individuals are, your AIA, Chubb, AXA, but for some of them, it's actually mostly on the corporate side, and they don't really have a general public mental health policy other than AIA. Yeah. So even for something called the CHESS, which is like a subsidized insurance provider for lower income individuals as well. So even getting us listed as a clinical therapy provider, it's very difficult. There's a lot of red tape, and there is no reason for it to be that way. So when it comes to working with insurance for Safe Space, we are actually working with an insurance provider as well. We can't say anymore because of a non-disclosure agreement. But Safe Space is definitely coming up because it'll be rolled out pretty excitedly once it takes off. But a part of what else could be done is actually on government expenditure. So other than working on insurance, the government can actually do more. Yeah, when it comes to supporting mental health initiatives. So if we look at it from Singapore compared to the UK, Australia, and the United States, Singapore's expenditure on mental health is very small. It's only 3% of the overall budget that the government has, compared to 11% in the UK, 7.8% in Australia, and about 5% in the US. 3% in Singapore is relatively small, even though our population size is definitely smaller, but a lot more can be done in that space. So we're hoping to see, if there's any government officials out there, if you need anything that we can do to support you in that aspect for affordable mental health care, let us know, because for us, we really strive to create a mental health tech ecosystem. And working with insurers, government, corporates, hospitals, and schools, that's actually something that all of us need to work hand in hand to create an ecosystem together.
Fascinating. Thank you for that. I agree, of course, and I relate, of course, with the need that there is much more that can be done. We are reaching to the end of our conversation, but I will still ask the last question because it's the one that I find the inspiring one. So I would like to ask you both, a bit what do you hope to achieve with your ventures in terms of the impact you would like to see happen? Who's ready?
Yeah, Joan can go first.
Okay.
Sure. I've been volunteering.
Yeah.
So
You've been nominated.
Yes. I think when it comes to what we want to achieve with Thoughtfull, it has not changed. Our why has not changed from day one of embarking on this journey. So I think our vision, to make access to mental health care more seamless and affordable has remained. The what and the how has obviously evolved, if not accelerated to a great extent. But really, when we want to talk about, bringing seamless end-to-end mental health care, that's a mission that we'll be, chipping away at and that we'll be driving towards over time. So, yeah.
Thank you.
Yeah, and we're not doing this alone. I mean, we have ecosystem players like yourselves at Galen, as well as peers like Anto, and I think together we will be able to really make a dent in where mental health needs to be. It's not about a good to have anymore. It's about where we really need to be in terms of the entire industry. And I'm glad that more there are more players coming in. Yeah.
Thank you for that, Antoinette.
Yeah, so I'm sure after hearing all of this, we can all identify that mental health is a mammoth project. It's really a big.
We are all going to reach out after this, Antoinette.
Oh, I know. So for Safe Space, it's the same. Our goal has not changed, where we really want to be a best-in-class mental wellness tech ecosystem. Working with multiple stakeholders to really tackle this together. So I mentioned, collaborations with government entities, hospitals, insurers, and other like-minded startups, actually, where we can complement each other's services. I think when we all come together and work as one to tackle this project together, we can get a lot more done when it comes to solving the treatment gap to provide fast and affordable mental health care. So for us, that's really the vision, is not change. And we're looking forward to see if there's any collaborations after this.
I hope so too. Thank you for that very much. There is a question in the Q&A, so please do take some time to respond to that, as it is a long one and a very deep one. So I please do encourage you to have a look at that. I can't steal any more minutes to the next session, which is I'll introduce in a second. Thank you so much for being part of the panel today and opening the last day of the cohort. A great hearing about what you are aiming to do. And I definitely relate and second that. So all the best with your ventures. Again, great thank you, Antoinette. A great thank you, Joan. And see you and talk to you soon again in the next session that we'll be having.
Thanks, Anna.
Thank you so much.
It's been a pleasure.
Thank you so much, Galen Growth, for organizing this.
Thank you.